Welcome to the deep dive. We're here to unpack complex stuff and really get you the essential knowledge. Today, we're tackling a topic that's, well, both fascinating and a bit unsettling: anthrax. You sent us some really comprehensive sources, and it was clear you wanted to get beyond just the basics to understand why it's such a unique challenge, especially for animals, and, what it means for us. We've dug into general overviews, but also specifics on horses, which it turns out is a very stark example. So our mission today: to give you the fast track on a disease that's ancient but still very much a current concern. Okay, let's get into it. So first off, what is anthrax, fundamentally, and what makes it such a tough adversary?
Right. So anthrax at its heart is an infectious disease. It's fatal, caused by this bacterium, Bacillus anthracis. It's what we call a gram-positive spore-forming bacillus. Basically, that means it creates these incredibly hardy dormant form spores. It hits animals, humans do, and
Yeah.
you find it worldwide, but it really primarily affects herbivores, grazing animals.
Okay, and you mentioned spores. That seems key. It's one of the most kind of astonishing things about it, right? This ability to form these really tough, long-lasting spores. Just how long are we talking?
We're talking decades. I mean, potentially many decades. When the bacteria are exposed to air, like from a carcass, they form these spores.
Hmm.
And they are incredibly resistant. Extreme heat, cold, disinfectants, drying out. They withstand a lot, and this makes them, persistent threat in the environment, like little time bombs in the soil. Then, once an animal takes them in, they switch back to their active form, and they produce these powerful toxins, a lethal one and one that causes swelling, edema. These toxins basically just wreck the body's functions: internal bleeding, massive swelling, organ failure, shock, and almost always death.
Decades. Wow. That incredible persistence, it just begs the question: how do animals, and let's focus on horses as our example, how do they actually encounter these spores if they're just lying dormant?
Yeah, the main way for horses is simply ingestion. Eating them happens when they're grazing. They pick up spores from contaminated soil, and it's often linked to specific soil types. One's high in calcium with alkaline pH over about 6.1. Those conditions seem to really help the spores survive long term.
So it's literally in the ground they're eating off.
Exactly. And outbreaks often pop up after some kind of environmental disturbance, something that brings buried spores to the surface. Think like a long drought followed by heavy rain. That can concentrate spores. Or even construction, digging, soil excavation. Overgrazing is another factor. Makes horses eat closer to the soil, ingest more dirt. And if they're eating really coarse, rough forage, that can cause tiny cuts in their mouth, giving the bacteria an easier entry point.
Okay, so ingestion is number one. Are there other ways?
There are. Inhalation is possible, breathing in spores, maybe from contaminated dust. It seems less common in horses, though. And then there's skin penetration. Spores getting in through cuts, scrapes, abrasions, even insect bites are implicated. Biting flies might mechanically carry the bacteria from an infected animal or carcass to another.
Right, but it's important to clarify this isn't like, say, the flu spreading easily animal to animal, right? Or human to human.
That's absolutely right. Direct transmission is very rare. It's almost always about encountering those spores in the environment. That environmental load is the real driver.
Okay, so you have this hidden threat, these spores. If an animal is exposed, what would you even see? The sources we looked at suggested it moves frighteningly fast.
It does. Extremely fast. The incubation period, the time between infection and signs, it's typically about 3 to 7 days in horses. But it can be shorter, like just 1 day, or longer, maybe up to 20 days. The huge challenge is how rapidly the disease progresses after signs appear. Death can happen within 2 or 3 days, sometimes even faster. In fact, the most common scenario, unfortunately, is finding the horse already dead, with few or maybe no warning signs noticed beforehand. That's the peracute form, just sudden death.
Wow. So in cases where there are signs before death, what might those be? What are the red flags?
In what we call the acute form, you'd look for things like a very high fever, severe abdominal pain, colic, basically. And something quite distinctive is often profuse diarrhea, which is frequently bloody, enteritis. You'll also see marked depression, just total lethargy, weakness, maybe muscle tremors. And another really suggestive sign is the severe localized swelling edema. But it's non-pitting, meaning if you press it, it doesn't leave an indent. You see this often around the head, the neck, under the chest, the lower belly, genitals. If the throat and neck swell badly, it can actually suffocate the animal. And then after death, there are some telltale signs too. Dark blood that doesn't clot properly might ooze from the nostrils, mouth, anus, vulva. And the carcass often lacks rigor mortis, doesn't stiffen up as expected, and decomposes really, really quickly.
Okay.
Oh, and pregnant mares might abort. If they're lactating, you might even see blood in the milk. It's grim.
That sounds incredibly severe. And given how fast it is and how it could maybe look like really bad colic or poisoning, how do you even diagnose it? And I remember seeing huge warnings in the sources about safety for people and, well, for not spreading it further.
Yes, this is probably the single most critical point for anyone encountering a potential case. Safety and containment. First, suspicion. Sudden death, especially in an area where anthrax is known to occur, or multiple animals dying quickly with bleeding or weird swelling that should raise alarm bells. But here's the absolute crucial rule. If you suspect anthrax, do not open the carcass, do not perform a necropsy, don't even move it if you can avoid it.
Why is that so critical?
Because the bacteria inside the dead animal are in their vegetative form. Opening the carcass exposes them to oxygen, and oxygen triggers them to form those incredibly resistant spores we talked about. You basically turn that spot into a new, long-lasting source of infection, a massive contamination risk. It makes getting rid of it almost impossible.
Okay, crystal clear. No opening it up.
Yeah.
So how do you confirm it's anthrax then?
A veterinarian needs to handle this using very strict precautions. Full personal protective equipment, aseptic technique. They would carefully collect a sample, not by opening the body cavity, but maybe a sample of the fluid from the eye, the aqueous humor, or a small blood sample from a vein like the jugular in the neck. These samples are much safer to handle and send to a lab. The lab can then do bacterial culture, try to grow the Bacillus anthracis, and PCR testing, looking for the bacteria's DNA, is very effective. You can sometimes see the characteristic bacteria under a microscope on a blood smear soon after death. But that becomes unreliable pretty quickly, maybe after 24 hours. There's also a rapid test called immunofluorescence that can confirm it quickly by detecting bacterial proteins.
Right.
And crucially, anthrax is what's called a reportable disease, meaning vets and labs must notify state or federal animal health authorities immediately. That triggers official control measures, biosecurity protocols. It's a public health issue.
Got it. So diagnosis is tricky and hazardous. What about treatment? If it's caught early, is there any hope? And maybe more importantly, how do we prevent this in the first place?
Yeah, treatment is, well, it's often a long shot simply because the disease moves so fast. By the time you realize what it is, it might be too late. The prognosis is generally very poor. However, if, and it's a big if it's diagnosed extremely early, aggressive antibiotic treatment can sometimes be life-saving. We're talking high doses, usually of penicillin or oxytetracycline, given intravenously right away. And treatment needs to continue for at least 5 days. But again, early diagnosis is the absolute key, and that's rare.
So prevention really is paramount then?
Absolutely. Prevention and control are everything with anthrax because it's so deadly, and it's a zoonotic risk, meaning it can potentially infect humans, although less commonly than animals.
Okay, so what are the key prevention steps?
First, isolation. If you have a sick animal or suspect animals, isolate them immediately from healthy ones. Same for any animals that were in contact. Second, and I'll say it again, carcass management is critical. Do not open suspect carcasses, period. They need to be disposed of promptly and safely. Ideally, incineration is best. If not possible, deep burial, like at least 6 feet deep, covered completely and located well away from any water sources.
What about that old recommendation of using quicklime?
Yeah, that's often mentioned historically, but current thinking is actually against using quicklime. Some research suggests the calcium might actually help the spores survive longer term. So not recommended now. Formaldehyde treatment before disposal might be used sometimes.
Interesting how that advice changes. Okay, what else?
Decontamination. Anything contaminated soil around the carcass, stables, equipment, tools, needs thorough disinfection. Formalin-based disinfectants are often recommended. You need something proven effective against spores. Then there's vaccination. There's a vaccine available. It's a live attenuated spore vaccine, uses a weakened live bacteria. It's generally only recommended for horses and only in areas where anthrax is known to be endemic, a recurring problem, usually given once a year, about a month before the typical anthrax season in that area.
Any caveats with the vaccine?
Yes. Because it's a live vaccine, you shouldn't give it at the same time as antibiotics, as the antibiotics could kill the vaccine bacteria and stop it from working. Also, its safety in pregnant mares isn't really established, often contraindicated. And like any vaccine, adverse reactions can sometimes happen. And finally, just general environmental management and biosecurity. Avoid grazing animals on known anthrax fields if possible. Be careful about soil disturbance in those areas. And anyone handling suspect animals, carcasses, or contaminated materials must use proper personal protective equipment, gloves, masks, protective clothing, because of that zoonotic risk.
Wow. Okay, that was quite the deep dive into anthrax. From understanding those incredibly resilient spores, almost like biological time capsules,
Right.
to the absolute life or death importance of not opening a carcass and the
Wow.
careful steps for disposal and prevention, we've really unpacked what makes this ancient disease still such a potent modern threat. The idea that just digging in the wrong place or a flood could unearth a deadly disease from decades ago, that's really something.
It really is. And if you think about the bigger picture, it just highlights this incredibly complex connection between the environment, soil conditions, weather, animal health, and ultimately public safety.
Yeah.
It's, I think, a powerful reminder that even with all our technology, we have to stay vigilant against these ancient pathogens that nature keeps stored in its archives, so to speak.
So for you listening, maybe think about that. How the sheer resilience of something microscopic, like these Bacillus anthracis spores, shapes everything. Our approach to farming, to land management, to veterinary medicine, public health. An outbreak can literally spring from the earth years after anyone thought the risk was gone. It gives you a different lens, maybe, for looking not just at disease, but at our deep, ongoing connection to the living environment all around us. Thanks for joining us on this deep dive.